Good morning. I'm Dr. Sparman, and I thank you for bringing me into your home, in your kitchen, in your living room every morning, Saturday morning, 9 to 9:30, and in your cars on the street. Allowing me to tell you a little bit about life. What are your resolutions for this year? I know what mine is. I want to live. 1. 2, I want to live healthier. And 3, I want to make you healthier. Lawson, I want to congratulate you. Congratulate you, actually. You became a vegetarian, and I saw you're looking better than me. People think that because you're a vegetarian that you're supposed to be very, very slim. No. They're the vegans and they're the vegetarians. The vegetarians eat fish. And the vegans eat no meat at all. But, I got a problem with this. You can cut some beef and pork and so forth, and you just put some seasoning on that stuff, and you cook it, and you don't have a problem. It tastes good. Why is it with fish you got to go the extra mile to take that rankness out of it? That's my problem there, and I want you to call me if you know about, if you know about the way you can do it, and you can minimize that smell of the fish, the rankness. I know you need to marinate with a lot of stuff, but give us some tips. You can call and give us some tips on that. 434-1771, 434-1790, 434-1791. Let me know if you got any tips for me that would direct us how we can marinate or prepare a fish without having that rankness. I know many times I go, even when I get the fresh fish and I go and prepare it, I still have that. I tried to make some fish broth the other day and didn't come out too well because of that. Cold. And fish is better for you than the red meat, of course. And some people I know can prepare that fish in such a way that you wouldn't even know it's fish you're eating. Today, there's a young fellow that did not show up on my at my party last Friday. Last Christmas. We have a Christmas party every year. A young 12-year-old, and he has had osteosarcoma of one leg, and he's lost a leg, and it's a friend. I consider him a friend. I see him every Christmas at our function. But I didn't see him this Christmas, and I have a gift for him. And I lost his name and number from the old phone, so call me, 624-3278. 624-3278. I want to talk to you. Got a gift for you. And, or you can call the station, 434-1771, 434-1790, 434-1791. Call us. This is VOB 92.9 FM. I got a couple of callers, but I'm going to just let me just say something before I take them. Stay there. As I said, I'm happy to have you listening to me this Saturday morning. Dr. Sparman himself, and we're going to live healthier this year. That's, how I tell you, the fourth thing I wanted to do is to lift the bar. We want to be the health region, health center, or the health island of the region, actually. Supreme, super healthcare, and that's one of my goals for this year and onwards, but I'm going to put an extra effort into that so we can live longer. Have you ever thought about, when you can unite with your spouse or your partner for supposedly the rest of your life? You can choose a male or female. You think, in this day and age, I have to, sir or madam, you need to give me a health certificate. Make sure you have no sexually transmitted disease or any HIV. Today, I want to tell you about something else. well, let me rephrase that. African Americans or people in the Caribbean or people in the South Americas or Central Americas have a high incidence of sickle cell anemia. And anemia really is if you're a male and your hemoglobin levels are less than 13 and you're female and your hemoglobin levels are less than 12, then you're anemic. And anemia has to do with, as a matter of fact, it has to do with hemoglobin in your red blood cells, and they take the oxygen to the various organs so you can live. But some people have a problem with hemoglobin. You're supposed to have hemoglobin A and you have S instead. But the thing about this, now we want to stress today a little on sickle cell anemia that affect our children and blacks more than other populations actually. They live around 40 to 50 years old, so it means they come to this world and they have a finite lifespan. I think that if you're going to make a child, I think you should want to give that child optimum head start in this race of life. So we always try to make our kids better, give them good genes, right? Like me, I say that all my kids got to look better than me. If they don't look better than me, something wrong. And I wouldn't want to bring a kid looking like me in this world. So you try to make the match, right? Anyway, let's go back to what I'm saying, is that sickle cell trait now, which is you don't have the disease, but you got a part of it. That's a trait. You can live a normal lifespan, but if you merge or your partner has sickle cell trait, then you'll produce a child, and you can produce a child that has sickle cell anemia. We'll talk about sickle cell anemia today, and somebody's going to call us and tell us, or people will call us and tell us how to marinate that fish so that we could have better fish and more vegetarians. Whoa. So, we got a caller. Good morning.
Hello, morning.
Morning.
Dr. Sparman.
Yes,
I called to ask a question.
Please, ma'am.
When I can put down you could thing.
Certainly.
I gotta read it to you.
Certainly.
Black tea assists in lowering cholesterol. Hello?
Yes, go ahead.
And black tea is assisting in lowering cholesterol, and it's good for the heart. Medical research also suggested that black tea promote healthy teeth, skin, and bones. You could give me the answer. I will be listening.
Yes, good. Thank you. You see that? This is nice. Thank you for calling on this Saturday morning. It's 9:11 on VOB 92.9. And yes, black tea. You staying close to the plant, aren't you? Yeah. Black tea actually has antioxidants. That's what it is. The whole process of cell death and cell death will progress into tissue death, into organ death, and then body death, right? It starts from the unit organ, which is the cell. So this free radical stuff that happens, we eat a lot of stuff that causes, an oxygen itself cause us to have these free radicals, and with this oxidation process, I'm not going to go too deep into it, that occurs that cause these free radicals. You have these electrons in the cells trying to grab from different cells, and some cells can't take it and they die, and that's a cell death process. Antioxidant stops the process. It absorbs that unstable electron, and that way it stops the whole process. That's why black tea is good for you. It's an antioxidant. It helps your heart. Any antioxidant, including omega-3, 6, 9, vitamin C, vitamin E, all of those things are antioxidants. So to answer your question, and thank you for calling, yes, it's good for you. And anything that would decrease or increase the lifespan or decrease cell death has to be good. Antioxidant, black tea. Got another caller. Good morning. Saturday morning, good morning.
Hello, good morning, doctor. Sorry.
Yeah, yes, please.
Sorry, it's one radio off.
No, it's okay.
Question, doctor, please. What causes the feet to be swelling all in the calves and have like hard lumps and turn black all around the ankle and so?
Yeah, okay, good morning. Thanks for calling. You know, there are lots of things can cause that. But let me give you the major ones. If you have swollen legs, if it's one side, if it's only one leg, you look for blood clot in that leg, in the veins. If it's if both legs are swollen, could be your heart, could be you have a weak heart, or it could be you have kidney problems, or it could be you have liver problems, or it could be that you have very poor circulation. How do you know? How will you find that out? There are a lot of tests. You can go to the doctor and they can figure out, do an echocardiogram. That's the first thing I'll do, and some blood tests. And most times I'll point them in the right direction. Okay, so consult your doctor and get that echocardiogram and the blood test and you'll be okay.
Thanks.
Pleasure, ma'am. We got another call. Good morning.
Hello, good morning.
Yeah.
I am calling to find out about the process of the cells. If you have degenerative cells and you correct your diet and start eating properly, will those cells be renewed to the state that they should be in?
Okay, good. Yeah, that's a good question. I think I understand your questions is if you got cells that are dying and if you modify your lifestyle, if they will get better, right?
Yes, please.
Yes, good. You could put on an answer. Basically, the cells all have a certain lifespan. Let's take one cell, the red blood cell. We were talking about sickle cell anemia, where you have hemoglobin S instead of hemoglobin A within your red blood cells. And, you know, red blood cells have the shape of like a donut without a hole in it, you know. And it's malleable. It means it can go through all kind of small capillaries and so forth and feed your entire body. But it has a lifespan of 120 days, 3 months. So what happens when that cell dies? You got to replenish it with a new one. Same thing happens with your skin. You'll see your skin peeling. Oh, it's a shedding of the dead skin, and a new one is on there already. So every cell has a finite lifespan. So yes, and if you're eating bad and you have these cells that are dying, but if you modify your lifestyle, when those die, the others that come by will live longer. So, like, let's go now to the simplistic form of sickle cell anemia. Instead of 3 months or 120 days, if you have sickle cell disease, it will these cells sickle and they die within 15 days. So you decrease the lifespan by 7, 8, times, right? So it's the same thing with eating bad food habits, and all of this, producing all of these free radicals and so forth. If you modify your lifestyle, span, the turnover, the old ones go and the new ones come in, and then you become almost new again. So yes, it doesn't matter if you start age 50 or 40. You start, okay? It's just like smoking. You stop smoking and you find out what happens. After a year or two, you have the same risk factors as people who never smoke. Thank you for calling. Yes, so sickle cell anemia. Let me go into it a little bit today. We said that, so remember that you don't want to produce children that will have sickle cell anemia, right? Because we talk about a finite lifespan, right? So, but if you have the trait, you should check for it. If you have the trait, then you don't want a partner whom would have the trait also, or has the trait also, because you can have a child that is a sickler. Sickle cell disease, it has to do with you're born with hemoglobin F, and then as you get adult, you have hemoglobin A. But when there's a change in the genetic level, there's a amino acid called valine replaces glutamic acid. The position 6 of the beta chain. Don't worry all those big words I'm talking about there, but some change in just one position 6. And now, because valine caused the hemoglobin and they make the red blood cells more, in other words, it's not as malleable. It's more like as soon as you remove oxygen from it, it sickles and forms like a shape that could damage your, as a matter of fact, block your arteries, give you stroke, heart attacks, and all damage of your kidneys and spleen and so forth. That's not good for you, because what happens is that you have these silent strokes occurring, and then there's the crisis. How they present? How do you know if your kid would have this type of stuff? I mean, a lot of times they have a lot of bone pain, the long bone, back pain, and sometimes they just present with abdominal pains and so forth. But a crisis is something, it obstructs your schooling. It does listen, it's not a nice disease to have. So we'll talk more about it. And as we go on, I'll take a break right now. We got a call? Good morning. You're on the air. I ain't playing nothing for nobody today, man. We on the air right through. How are you this morning?
Good morning, Dr. Sparman. I'm
Yes.
pretty okay.
Yes, not bad. Thanks for calling. How can I be of service?
Dr. Sparman, I'm having a case where my hair is breaking, and I've been told that I'm lack of vitamin E. Is that so?
Yeah, but vitamin E is good for almost everything, the skin and hair. But I mentioned a couple of weeks ago about two things that are good for you. One is you should linolenic acid. You go to the herbal store and get linolenic acid. Take one tablet, 500 milligrams twice a day.
Okay.
That prevents breaking and gives you healthy hair. And primrose also. Primrose, yeah, you get 500 milligrams of that twice a day. Those two things, you take it. I've seen people who have lost that, been losing their hair and so will take these things, and what happened, brings your sheen back and stop the breaking. If you stop the breaking, it'll get longer. Go for those two things, primrose and linolenic acid.
Okay.
Vitamin E, I would not stop you. Take a tablet a day. I do that too.
Okay. Thanks a lot.
Pleasure. Morning, you're on the air.
Good morning.
Good morning. How can I be of service this morning?
Don't know. All of my hand is numbly ice go to my hand. I don't know what is wrong.
Your hand is numb. You got diabetes?
No.
You don't. Just this is new, or this is something going on for a long time?
I say something new, because when I go to the I don't know what is wrong, but I like losing his strength with left hand.
Oh, and your left hand, your right hand is okay?
Yes, but now that is all right.
All right, just give me two last questions, then you can put on and you listen to me. Do you have a pressure problem?
Yes.
Good. Secondly, what age group, or how old are you? Just give me an average.
65.
Good. Put on and listen to me now.
Mm-hmm.
I was saying earlier about people that would have had silent strokes and don't even know it. If you got a pressure problem, you got high blood pressure, you're at risk for stroke. And I'm not saying that that's what the caller would have had or has actually, but it's something you think about. Sometimes you have a stroke and you don't even know you've had it. You have more silent strokes than you have real strokes. A lot of times the small one comes in before a couple of them before the big one come. If you got a pressure problem, I have to think that maybe that's the area she's going, because it's on one side. If it's on both hands, then you worry about other things. Diabetics would have a problem called neuropathy, but it affects the feet most so, but it's mostly both feet at the same time. And most of the things that would affect your hand, weakness and numbness of your hand, it'll be bilateral. Some type of electrolyte imbalance like potassium and calcium and magnesium and phosphorus, those things can cause these type paresthesias. We call them paresthesias within the hands and so forth and the body. However, yours is unilateral on one side. I would think stroke, so you should consult your medical doctor. And maybe he will do some examination, and if that right hand is weak, you could have had a small stroke. A CAT scan would probably demonstrate that. So that's the route I would go. But don't forget, stay away from the salt. And take your pressure problem tablets actually, and keep your pressure down. Normal is around 120/80. Keep it around somewhere between 120 130, and that'll be good for you. But consult your doctor this week. You on the air, good morning.
Yes, I'm late, but the phone like it cut off. I don't know what went wrong with the phone just now.
Oh, you didn't hear me?
No, I don't know what went wrong. Like it cut out or something.
But you're talking about your numbness in your hand, right?
Yes.
Yeah, I was saying that maybe you should go and check with your doctor and see if you have a stroke, or if you would have had a stroke in the past. Sometimes those are the residual effects of the stroke.
I never had a stroke yet.
Well, the thing is, you might not know. There's something called silent stroke.
But I will have to go to another because she don't work on Saturdays.
Oh, I see. Well, good. No. Well, if this thing happened, we do be talking about a few weeks at least, right?
Pardon me?
You've been having this problems about a few weeks, right?
Not really, but I just wake up this morning. I just be hitting my hand and like ice going through my hand. And like the left hand leaving me like they got this strength and I can't hold up anything in the eye.
Go to Queen Elizabeth Hospital and let them check it out because it could be a stroke. You know, one side of the hand. Yes, go. Don't take no chances and wait because sometimes they progress. Okay.
All right.
Yeah, thank you, ma'am. Thank you.
Thanks.
Ooh, all right. So here we go. We're talking about. You mean nobody's gonna call me and tell me about this marinating the fish? Listen, guys, I want to know. I want to learn from you. I don't know everything, you know. I know some things, but you know a lot of things, right? So call us. Somebody's listening. They want to know how to prepare the fish to prevent it from smelling rank. So it can be very edible. Come on, we got 5 minutes. It's 9:25, guys. And, all right, you're in the air. Good morning.
Hey, good morning.
Good morning, ma'am.
I have pains in my knees.
Could you speak a little louder?
I have pains in my knees. My knees, they're always hurting. One in particular, this is the left knee. Sometimes it's swelled. Every day I have pain in the knee. Now the pain is going into the ankle.
Now, you know, I'm having a bad reception. I'm going to repeat what I think you said. You're saying you had pain in your knee?
Yes.
In other words, you got arthritis or you don't know?
No, I was so sore, but still I was wondering if it's more than that because the pain is consistent. I have the pain every day.
Oh, I see. You're very active or you're mostly in bed?
Yes, very active.
Very active, yeah. Well, you should. There's some, you know, you can take an X-ray. A lot of times we get older, and around the joints, there's some cartilage that protect us. So you have a lot of friction normally would occur between the joints, right? So if you have smooth, nice cartilage over the bone, things work good, a nice fluid there, the fluid within the joint. As you get older, that cartilage get worn down, and then bones start touching bone, and then you have problems. Lots, you increase the frictional force, actually. And then also there's problems with the fluid exchange within the joint, and that's how arthritis come into being. Most times as you get older, you got pain in your knees, mostly in the mornings. Yes, it's arthritic pains, but then there's certain type of arthritis that are treatable, and you get a lot of relief with certain type of medicines, whether it's rheumatoid arthritis, whether it's osteoarthritis or whatever. So let your doctor do some nice tests, ESR and all those nice tests, blood tests and so forth. An X-ray of the knee can point us in the right direction, but there's some drugs you can take in the meantime that can help you, like naproxen. You can get over the counter. Naproxen is an anti-inflammatory. Once you don't have a problem with bleeding or so forth, those are nice drugs that can help you with those inflammatory processes. So
That's all the pain you're talking about, right?
Excuse me?
Most of the time.
How do you do that?
I blame the salty fish about 5 minutes, right?
Uh-huh.
Then I will wash the fish out. I will season it with some good old Bajan season.
Uh-huh.
There's also some fish season that sells in the supermarket. You can use that. Marinate the fish for 5-10 minutes.
Uh-huh.
And then you're good to go.
You're good to go. So you buy the fish from the market or you get a fresh one?
Sometimes I buy it from the market or the supermarket, but I haven't bought much fish lately because I'm not getting the fish I want. It's fish.
Well, thank you much. Thanks for your input and thanks for calling, ma'am. And don't forget, naproxen or Aleve or Cataflam will help you. And don't forget to consult your doctor, okay?
Okay.
Have a nice day, okay? Yes, we got one more caller.
Good morning.
Morning. Before you ask me any question, I'm gonna ask you how you like that. You had a good week?
Yes, I did.
Good. What are you doing right now?
Well, I'm preparing my
You're home?
Yes.
You're home?
Yes, I'm going to work this evening.
Oh, yeah. You listen to me every Saturday morning?
Yes, I do.
Why do you listen?
Because it's interesting.
Yeah, what makes it interesting?
The questions and the answers.
You like the music?
Sometimes.
But I didn't give you any music today. You okay with that?
It's all right with me.
How do you prepare your fish?
Well, what I do, I always keep a bottle of hot peppers crushed with garlic, onion, and vinegar.
Okay.
Then I'm going to do my fish. I just pre-soak it with a little lemon salt and water and put some of that mixture in.
For how long?
About 3 to 4 minutes.
Okay.
And then I marinate my meat.
Oh, wait, hold on. You got to go step by step. Then after that, you wash it off or you leave it?
I wash it off.
Okay.
And then I marinate my fish. And that's it.
You see, I am not a cook, I'm a doctor. Come on, man.
I season my fish with Bajan seasoning, which I make myself.
Oh, you make that yourself?
Yeah.
So I get the fresh fish from the market, and I put the salt and the lime on them, and for 4 minutes, I wash it off.
Hold not so fast. What I do, I put lime and salt in water.
Okay.
Then put some of the mixture of the hot pepper, garlic, and onion and vinegar in the water along with the fish.
Perfect. And then after that?
You wash it off and you season it and you can do what you
do. It if I want.
Steam it if you want to. Bake it if you want to. Pan, stir it, whatever.
Got you. You got a nickname or you want to give me your first name? Give me a nickname so tomorrow I can tell you.
No, I don't have any nickname.
But what's the name?
Cheryl.
Cheryl, next week you tune in, okay? Because I'm gonna tell you what I do. I'm gonna go home and try this stuff and tell you about it. You got another question quickly before I go?
No, I don't.
God bless you. Okay. Thank you. All right. God bless you. I'll talk to you next week, guys. I won't be gone. I didn't even play a song for you today. We had fun though, And, you got another? What is that? One more. All right, let's go.
Hello.
Good morning.
Yeah.
Hold on. Let me turn the radio off.
Yeah,
you're asking about what to keep the fish from smelling.
Yeah, please.
Yeah, green apples. Golden apples.
Okay.
You can put it in your seasoning.
Okay.
Or you can do it cook it in when you're doing it, put it in it. Green apples, that's all.
No, let's go back. What do you do with green apples? You cut it or you grind it? What do you do?
I grind it in the seasoning.
Uh-huh.
And I even cut it up inside in the gravy.
In the gravy?
Yeah.
Does it give a good flavor to the food?
Yeah, it doesn't taste, it doesn't smell rotten.
Are you kidding me? Well, listen, one more thing. When you get, let's say I bring the fish from the market. I wash the fish off.
I wash the fish off. I don't put salt on my fish, on my meat.
Right.
I put lemons, lime.
Uh-huh.
And I always keep apple cider vinegar.
Right.
And I put it on it before I cook it. I doesn't wash it off. It does not wash off the apple cider vinegar.
Oh, you don't?
No, I don't.
You keep it in there.
Mm-hmm.
And then you put this. Then you mix this stuff with the
golden apple. Yeah, grate it or put it in a blender. However I make my season, I put that in it. I use that in all my meat.
Would you make the golden apple drink and then use that on it, or no? It's got to be the real
golden apple, the green one
with all the fiber.
You cut the flesh off.
Yeah.
And just how you cut it, the onion, the season, everything.
Yeah.
You do it in that. If you buy seasoning, you can do up the apple, the golden apple, and put it in seasoning.
Ah, man, I love this one. So, and then you leave everything. You don't wash nothing off. What do you? If you want to fry the fish, let's say you're going to use good oil, like olive oil. What do you use? Flour to fry that with?
Yeah, I flour it.
Got you.
I flour it.
Got you.
I flour it.
You ever try using oatmeal to replace the flour?
No, I never.
Oh, okay. Somebody told me that was good. What's your name again? Listen, you can tune in next week because I'm trying these things and I'm coming back to you guys.
My name is Doreen.
Yeah, you eat other type of meat or no?
The oat meat, I can tell you. The oat meat I don't really use for a joke is beef.
Oh, I see. But
I use a lot of fish.
A lot of fish. Good. Yeah. Keep it up. Let's have a healthier year. Thank you for calling. Yeah. What's your name?
Doreen.
So Doreen and Cheryl can get a follow-up next week when they come on here. Thank you for listening. Yeah. Okay. God bless you. Well, I got to leave now, guys. I got to go.
Doctor, one last question.
You take one, okay.
This one says SC, that's sickle cell.
Right.
Sickle cell can only, it says, can sickle cell be only transferred from parent to child, or is it contracted in any other way?
Parent to child. That's it.
That's it.
In other words, you get it from your parent. It's something called autosomal recessive disorder. You have to get it. You can be heterozygous or homozygous. Heterozygous means that you only get one gene from your parent, mom or dad. They can give it to you. And then you have this trait now. You got a sickle cell trait because you got a good hemoglobin A and a bad one, hemoglobin S. So when that hemoglobin A and S from one parent combined with another hemoglobin S from another parent, the two S's join together in a proportion of 25%. So you have a 25% chance of having a child with the hemoglobin SS. Two S's together. So now, hemoglobin, it comes down from the parent. You gotta get it from the parent. That's what I'm saying to you guys. You're choosing a partner. Make sure they're not sickle cell trait. They don't, because remember, the sickle cell traits are normal. I want to thank you guys for listening so much, and thank you so much for being with me every Saturday morning, 9 to 9:30. And again, thank you, Barbados. You guys are lovely. Healthy year. We'll talk more about this fish staff when I come back.
Boys on Barbados.